Good morning, everybody, and welcome back to your Lunch Break Live. My name's Ivana Harinque if you're new here, and if you're not, thank you for coming back. Today is Thursday, August the 4th, and today we're talking about COVID. Now, I know everybody hears that and they probably immediately click off because nobody wants to talk about COVID anymore, but I thought that it was worth giving you a look at what our state is looking at right now in terms of case numbers and hospitalizations. We also learned this week that the Alabama Department of Public Health is stopping its daily data dashboard, which say that 3 times fast, with all of the numbers that are coming in of COVID cases. So it seems like a bit of a COVID milestone we are hitting. Today, I am joined by our data reporter, Ramsey Archibald. Ramsey, you have been way too invested in coronavirus data for 2.5 years. I know that the end of that dashboard probably feels like an end of a lifetime to you. So tell me about the dashboard. What's going to happen now if people have been relying on that for data?
Yeah, and it's funny you say people probably click off as soon as they hear we're talking about COVID. Well, it turns out the Alabama Department of Health is clicking off too, it seems like. So they're moving to once a week reporting instead of daily reporting. They've been doing actually every weekday for the past several months, and it's worth noting also that there were times when case counts were low that they kind of drew back on reporting. Even earlier in the pandemic, there was a time they were doing just 3 days a week. But this one does feel different. The note on their dashboard, indicates they're looking to move past kind of daily counting and move into a time where people's, everyday lives aren't as affected by this virus, while noting that, we're going to be living with this, for this foreseeable future. But I think the time that they decided to make this move is interesting because, like I said before, they had previously drawn back during times when case counts and positivity rate and that sort of thing were quite low. And that isn't really the case right now. Tracking the virus has been made more difficult recently because of the advent of at-home tests. Everybody has them, they're free. You can get 8 free ones from the federal government. If you don't know that, maybe take advantage. But the fact that those are so widely available and, the efficacy of those is kind of questionable, like whether they work as well as some of the old tests. We don't know, especially with the new variant that's going around right now. But those at-home tests make the state's numbers, less reliable, which may be part of the reason why they're deciding to shut down the dashboard. Because comparing the current positivity rate or case counts to previous waves is just not as useful as it once was.
Well, and you bring up those at-home tests, Ramsey, and I think of several people I know, even right now, who have COVID, but even people that I've known in the past year or so that have had immediate access to at-home tests, who have tested and say they tested positive for COVID. I don't think any of those people reported those results to the state. And I don't think that my friends or my family or the people I know are different than the rest of the state in that manner. I don't think that most people who are taking at-home tests that are getting a positive result are reporting it. Number one, either because that's the last thing on their mind because they are worried again about having this virus, having to contact trace and do those things. Or number two, not really being sure where to start. I mean, we all remember back at the beginning of this pandemic when getting any type of phone call to go through was just a nightmare. Getting any type of test was a nightmare. The data collecting, the data reporting was just not there. So it seems like many people, even if they wanted to report it to the state, probably don't know how. So I think that's a good point.
Yeah, and you're right. I don't think anybody is taking a test at home and then finding a way to report those to the state. I mean, that's just unrealistic, like you said. I do think sometimes there are people who maybe test positive at home and then they go to their doctor to get an official test to confirm, the results of those at-home tests. And then we would get numbers, on that in the official dashboard, but I don't know how often that's happening either. I mean, I think most people probably get a positive result and then they stay home, for a few days until they get better. So like you said, it makes it very difficult to track the data these days.
Well, and right now we know again, and this is from information from this dashboard. I think a lot of us have probably bookmarked it at this point because you're using it so often. But that dashboard, according to their data, there currently is a moving 7-day average. So essentially what that means is the average of the last 7 days of their data shows that 29% of those tests were positive. So what they're calling that is the 7-day positivity rate or percentage. Depends on where you look, what the wording is there. But it's 29%. That's pretty high, Ramsey. So we're cutting off, again, this reporting of this data, while we do know that hospitalizations are relatively low, they have not spiked as we've seen in other waves of COVID. But again, this rate is a lot higher than it's been in the past. So kind of explain that to me, why reporting and why people are getting a little bit less concerned right now about COVID when we still got that 29% positivity rate.
Yeah, I mean, it's a great question, and it's one that I don't have a really solid answer for you for, unfortunately. To put it in perspective, that 29% positivity is higher than we ever saw before the first Omicron wave, right? So right now we're seeing a lot of Omicron variant BA.5, which is kind of the dominant strain right now, super transmissible. But before the first Omicron, even during Delta and previous waves, we didn't get up to this level of positivity. So it's quite high. But I think that people are, one, just sort of tired of it. They're over the masking and everything. So I think you're seeing less interest in it from that point of view. And then also, this variant seems to have less severe illness. So we may talk about this a little bit more later. But the fact is that people who are getting sick maybe aren't getting as sick as they previously were. Some of that has to do with vaccines. Vaccines aren't as effective at preventing catching this current strain, but they are very effective at preventing severe illness and negative outcomes from even the new strains of the virus. So that's good. Alabama, while we have a pretty low vaccination rate compared to the rest of the country, is still, more than half of the population has gotten a vaccine. So, that may be mitigating it some. Go ahead. Sorry.
No, I was going to say, let's talk a little bit about that hospitalization rates and the severity of illness here. I'm going to pull up a chart that you have made, and I'll kind of hover over it in a second, and you can kind of explain the different lines here. But this is COVID hospitalizations and the ICU usage, and it goes back to a point in 2020, actually. And it goes actually back to August 2020, as you can see here. And I know that it's kind of hard to read those numbers, so I can read them off, but we'll also provide a link to this chart as well. But Ramsey, tell me a little bit about this graph, just what these lines mean that you see, the small line at the bottom and the line that's peaking a lot higher at the top.
Yeah. So that top line, the larger number, is COVID hospitalizations over time. It's weekly. It's a weekly 7-day average number. You can see basically these are the waves that we've seen of the virus through the past few years. So that first, when we started in August, that was the first kind of big wave we ever saw, followed by the winter 2020, 2021 surge. Who knows? That feels like 10 years ago now. And then you see Delta and then the first Omicron wave. And on the far right side of that graph is where we are. Not today. I think the most recent data for this from the federal government was, a couple weeks ago, 10 days ago, something like that. But relatively recent update. And you can see that not only are hospitalizations, while there is an uptick, they're not anywhere near what they were in previous waves. And the most important thing to notice is that bottom line, which is ICU usage, so that you can kind of equate that to severe disease, people who, are really, really sick or in some cases need to be on a respirator, things like that. That number has not increased very much at all. I mean, there are people with COVID in the ICU, but it's way, way lower than we've seen during previous waves, which that's good news.
Right. And you can even tell that. What I love about these charts you make, Ramsey, is if you are not a numbers person, which I am not, it is a lot easier to look at a graph like this and quickly see that this line on the very end, so where my cursor is right here, that is the current day, or at least the latest data we have, July 22nd, I think it's the last day on here. You can see at this bottom right-hand corner, it's so much lower on that graph than the left side of it, which again was in 2020. So you can just really get that quick analysis of this data to say, okay, this is a lot better than we were. And again, I know these numbers are hard to read, but your data shows, again, from the federal government, that the 7-day average of ICU patients with coronavirus, so that again is kind of reflecting the severity here of illness, was 63.6. So we can just round that to 64 for July 22nd. So about a week ago. And that is, again, a lot lower than some of these other peaks.
Yeah, absolutely. And one thing that's worth noting, after this July 22nd endpoint of the data here, what we've seen since then, and I haven't seen ICU numbers, but overall hospitalization numbers are starting to kind of plateau or even decline maybe. So they're not increasing. This chart here shows, kind of a steady increase, but we seem to have flattened out some, which is also good news. Experts I've talked with have talked about that as being kind of a sign that maybe we're, heading in the right direction, at least for now. And it's, you always want to be going down or not going up. So the fact that the numbers aren't going up anymore may be a really good thing.
Well, and right now, again, we know that we're averaging about 690 COVID patients in the hospitals, but that number of ICU is a lot lower. So we know that that is what our health professionals have really always been worried about, is people coming in the hospital and people catching COVID is one concern. But the biggest concern is that severity of illness, that ICU usage, especially taking up ICU beds across the state, which we know are limited as it is. Now, a quick question, quick variation from this, or a diversion from this graph, I should say. We got a question here about, when is this dashboard going to be updated, the Alabama Department of Public Health dashboard? When are they going to be adding data in? And is there a possibility that they would come back to daily updates if needed?
So it looks like, well, for now, to answer the first question, they're going to update on Thursdays. So they updated today for the first time this week, and they'll update again next Thursday. So we'll get 1 week's worth of data every Thursday at around 10 a.m., they say. Whether they'll go to daily reporting again, I don't know. They don't say, that they will keep that in mind. In the past, when they drew back, when cases got bad again, they started updating it daily again. So you would think that they retain that flexibility and be able to go back to daily reporting if it gets really bad. But the fact that cases and particularly positivity rate, like we talked about, are high right now, and they decided to make this move, indicates to me that they're ready to kind of transition into a new stage where they put less of an emphasis on case counts and positivity rate, which, like I said, with the level of at-home testing and everything, those numbers are less reliable than they used to be anyway. And I think, just to anyone who's looking to track waves, I think this hospitalization number is probably our best number to look at in the current state of things as for whether we're in a wave or not. And that number, I think, will continue to update daily on the dashboard. At least it has for the past week. So I don't know what that will look like going forward, but that number is the one that I would look at.
Well, and something too I want to point out is, in looking at this graph that you made, again, you took that data there, and plotted it on this graph. So this is data, again, that was reported from the Department of Health, and again, federal data. But something that I want to note is this top line here. You can see that when it rises and when it peaks, there's a really sharp incline, right? Like we go from a low to a almost vertical line up for these peaks. Now, something that's interesting about the latest data is this area of May, June, when this top line started moving upwards. It is not that sharp vertical line that we have seen in all these other peaks. It's a much slower, gradual incline there. Ramsey, is that what we're looking for? Is that kind of a sign of hope that people who are analyzing this data are looking for?
I mean, I think it's definitely a much more promising sign than that, huge vertical line was back when we were seeing those. If there's going to be an increase, you want it to be slow, especially in hospitalization numbers, because it gives, those hospitals, those healthcare workers time to react, time to, catch their breath a little bit. Whereas during those huge vertical spikes, it's sort of can be chaotic. What you also see is this slow increase, and then we've already started to sort of plateau, which again, that's great news as well. So we're not hitting those huge peaks that we hit in terms of just sheer numbers. So yeah, I would say that, we do want to see that. I mean, obviously what we would want to see eventually is no increase at all and no more COVID cases ever, but that isn't realistic.
What are some of our top medical experts saying right now about where we are with COVID?
I think there's a sort of guarded, cautious optimism. I mean, so we are I've been calling it a mini wave or a wavelet. So we're in a place where cases are high. It's hard to track exactly how high they are because of all the factors we've talked about. But, I think everybody just anecdotally has heard of someone they know or who has COVID now or had it in the last few weeks, or maybe you have it yourself. I mean, it's definitely out there, right? But I think the fact that there's less severe illness is a really good sign, and healthcare workers and experts are, aware of that, and that's a good thing. And the fact that we're plateauing is a good news, but we all have to be aware that this virus is still here. You can still get long COVID from it. You can still, develop severe disease. There's still people who are in the ICU, although the numbers are lower, and there are still people who are dying from this virus, all the time. So it's still a real thing. It's something we should be worried about. And the amount of virus that's in our community right now is relatively high still, despite the fact that there's less severe disease and despite the fact that we're not reporting the numbers every day anymore. So I don't think people should just shut down, even though things are looking pretty good.
Well, again, I know that like we said at the beginning, people probably immediately heard COVID and left, so they don't want to be here for this. But if you stayed, you at least maybe got a little bit of a glimmer of good news here, looking at that graph and looking at some of those hospitalization numbers, especially that ICU number really dropping off. That is at least a little bit of good news I think we can all agree on. Ramsey, thank you so much for your expertise here. Again, for also monitoring this data for the past 2.5 years and kind of breaking it down for the rest of us. We know that dashboard has been a little clunky in the past and could be a little bit hard to interpret. So thank you for that. And thank you for those numbers. We'll leave links here to all of those stories and to those graphs that we were just referencing that Ramsey made. So you can look at them and you can select dates and see that data for yourself. So Ramsey, again, thank you. Everybody watching, thank you. We'll see you tomorrow.